The pain was overwhelming. The clerk said, "I'm sorry, we're out."
Every time Carol Nelson Pond walks into a pharmacy, she knows she might not get the medicine she needs.
I had to go to 12 pharmacies.
She takes 30 milligrams of oxycodone every 6 hours to manage the intense pain caused by spinal stenosis.
If I don't have the medication, my body is going to go in withdrawal.
Oxycodone and other controlled substances, like the ADHD drug Adderall, are becoming harder to find because
it is abusable and is recognized as being abusable on the street.
Many believe the Drug Enforcement Administration's yearly quotas on the production of controlled substances are causing these shortages. The DEA blames manufacturing and distribution problems, but the agency did vote to increase the quota for some drugs in 2013. Oxycodone will see its quota increase by 25%. Meanwhile, there's a much bigger problem nationwide: short supplies of more than 260 drugs. Pharmacist Bonna Benjamin says patients are paying the price.
It's very stressful to deal with a diagnosis of cancer, but imagine adding on top of that the fact that the drug you need to treat your disease is not available.
This is my great-grandfather. He had the so-called breast cancer gene.
Carrie Fitzmaurice has stage 3 ovarian cancer.
I was put on Doxil. My blood marker numbers were as low as they had ever been.
But after just 4 injections of Doxil, her hospital ran out of the drug, and she was forced to switch to a less effective treatment.
Nobody knew at that time why. It was an extremely confusing situation.
9 months later, Carrie was finally able to get back on the generic form of Doxil when the FDA allowed temporary importation from a factory in India. But she says the fight's not over.
How can we make sure that they're going to remain available?
Last year alone, more than 500,000 cancer patients were told they were not going to get the treatment they needed. Carrie's become an advocate to help patients like herself cope with shortages.
I will continue to speak about the issue.
Meanwhile, Carol wonders how she'd handle not having her medication.
I have been nervous right up until today.
It was filled this time, but
there'll be the end of next month, and again, I will hope that I get the same response.
I'm Andrew McIntosh reporting.